Most people don't think of young, healthy adults when it comes to issues affecting health and health care. But Anne-Marie Berger shows us a group out there making it their sole mission to be on the front lines of the healthcare debate.
My name is Marie Berger. I'm 23, and right now my primary source of income comes from cartooning.
Berger is doing what she went to college to do. She illustrates and often writes her own graphic novels. She's a freelancer, and for her, working full-time means working all the time.
Yeah, I work about 90 hours a week. If I'm not sleeping or at someone else's house, I'm drawing. There's no downtime.
And she's not complaining. Cartooning is what she loves to do. This is what she's great at. But for someone who is just starting out and working for herself, affording health care is always a concern.
Oh my gosh, yes. I have a pre-existing condition, so without health care, I can't function. I need my medication. I need to go see doctors. And if I don't have health care coverage, then I can't afford to see those doctors. If I can't see the doctors, then I can't work, and it's just this really bad cycle.
Marie is affected by mental health issues, and without insurance, her prescriptions would cost about $1,500 a month. Fortunately for her, under the Affordable Care Act, Marie is covered under her parents' insurance until her 26th birthday, bringing the cost of her prescriptions down to a mere $300. Are you aware of options that you have?
I've seen some things on like internet sources about it, but nothing super definite. And it's hard to be educated at this point because there's so many different sources and they all lean one way or the other.
While she is covered now, she is very concerned about what will happen when she turns 26. Does having a pre-existing condition concern you that you'll get turned down for health insurance?
All the time. Yeah, I've got a big one too, so it's kind of a really scary, ugly word that while in reality, my life is great, I'm really happy. On health insurance, they're gonna see this as a really big risk for them, and they're not gonna wanna give me a good rate or insurance at all.
Marie's fears are very real, and there are many young people out there who feel the exact same way. How can they possibly afford health insurance? But here's the deal. They just don't know what options are out there. Don't worry though, the Young Invincibles are here to save the day.
So we're a nonprofit, nonpartisan organization based in DC. We were founded in 2009, actually around healthcare reform. They felt that the young adult voices weren't really being represented in the debate around healthcare reform. So they ended up holding this campaign to bring young adults to the table. That's partly how you get to stay on your parents' health insurance until you turn 26, got wrapped into the law. And our organization was born out of that.
The Young Invincibles address multiple issues affecting young adults, those between the ages of 18 and 34, like access to health care, higher education, and youth unemployment and jobs.
Seem to resonate with young people are the mental health and substance abuse services, as well as prescription drug services.
Right now, they're working with nonprofits across the country to help get the word out about healthcare options for young adults available through the Affordable Care Act. We spoke with them on a recent trip to Missouri.
It's definitely a game changer. There's going to be so many more options that were never available previous to the ACA.
Some of those include comprehensive student health plans, coverage for pre-existing conditions, savings on monthly premiums and out-of-pocket costs, and no more yearly limits on coverage.
Anyone between about like $15,000 a year and $46,000 a year in annual income will qualify for some sort of tax credit on the marketplace. So that really helps young adults, especially those with lower incomes or entry-level jobs, things like that, will probably be able to get affordable health care coverage on the marketplace.
But not all young people are on board with the marketplace and dispute the cost savings that proponents of the Affordable Care Act claim.
And the economic incentives do speak. You're not going to get these people to sign up by making them pay more for things.
Corey Whalen with Generation Opportunity recently discussed her concerns with Casey Nolan on Stay Tuned.
Right, so the concern is that we haven't really had an actual market in healthcare almost ever, especially in modern times with the way we deal with healthcare. The concern that I have is Obamacare isn't really doing anything except increasing costs for young people and then penalizing them with what the Supreme Court called a tax if they don't buy the more expensive insurance that's being offered through these exchanges.
There are a few things that it does require.
So the Young
that
Invincibles
gets it to
have
stay
their
in
work
line
cut
with
out
more
for them,
comprehensive coverage.
not just in explaining the benefits
It covers
of the
3 primary
marketplace,
care visits
but
per
spreading
year.
the word that it even
covers
exists.
preventive services.
Take Marie, for example. Remember, she's a college graduate who's concerned about the cost of health care. Have you heard of the marketplace? Health insurance marketplace?
No.
I think that that's a big challenge, is getting that education out there, spreading awareness. A lot of people just don't really know that these options are available. So making sure that they know that they have an affordable option, that they can go to healthcare.gov and see all of their options and pick an appropriate plan for them that's hopefully affordable, is really the key.
You'll be happy to know then with the ACA that pre-existing conditions don't matter.
Very good. Good to me. Good for a lot of people.